Good morning. This is Dr. Tariq. Today, my topic is to discuss the parts of medical terminology. There are three parts of medical terminology: prefix, word root, and suffix. Medical term should consist of at least two words: word root and suffix. Word root alone cannot stand together alone. Word root, they come like this: word root in the center, prefix before the word root, and suffix after the word root. That's why I have written like this. Word root is the core of the word. It carries the main meaning of the word. And usually it is some body organ where something is happening. Or there are some word roots which means color. Suffix is that part of the medical term that comes after the word root to modify the meaning. It gives us information about four things: procedure, condition, disease, and disorder. The eponym by which I made is PCDD: procedure, condition, disease, and disorder. This way is easy to remember: PCDD. The most commonly used suffix is itis. ITIS. Most commonly used suffix is itis. The third part of the word root is prefix, which gives us information about location, time, and number and state. It comes before the word root to modify the meaning, and I made eponym like LTNS: location, time, number, and state. It gives information about these four things. So let us begin with word root. There are two words, nur and itis. Nur is word root, itis is suffix. We just joined them, neuritis. And the second word is nur again, but the suffix is plastic. Plastic means surgical repair, plastic surgery, like that. So here if we add them together, neuroplasty, it is not a smooth pronunciation. So we add a vowel O. Neuroplasty. This way it sounds better. As I said, itis is the most commonly used suffix, and O is the most commonly used vowel. There are 5 vowels which we use to combine word root with the suffix. They are A, E, I, O, U. A, E, I, O, U. These are 5 vowels. All other alphabets are consonant. There are some rules of applying vowel between the word root and the suffix that I will tell you later. But so far we will discuss word root. We discussed already nur and itis, combine them, because itis is starting by a vowel itself, that is I, but plasty is not starting by a vowel, so we applied a vowel, that is O, neuroplasty. Another word root is gaster. Gaster is stomach, and the word is dynia. Dynia means pain. Stomach, gaster means stomach, and dynia mean pain. So if we want to join them, D suffix is started with D, which is not a vowel. So we have to put one vowel, that is O. Gastrodynia. Gastrodynia. This way its pronunciation is smooth. There are certain word roots which give us information about the color. Number one is eryther. ERYTHR. Erythro, red. Eryther mean red. Erythro, O is vowel. The word root is erythro, and O is vowel. When we combine them together, this is called combining form. And sometimes we use combining form also. And this is the fourth part of medical term. Erythro means red. The word here is erythrocyte. Erythrocyte is a technical name for red blood cell. Erythrocyte. Eryther means red and erythrocyte. Erythro means red. Erythrocyte is the technical name for red blood cell. Next word is leuc. Leuc means white, and you are familiar with leukemia. Leukemia. Leuc means white, and we are familiar with word leukemia. Leuc is white and emia is blood condition. So blood condition is too much white. That refers to a large number of white blood cell in the blood, which is leading towards blood cancer, which is already a blood cancer. Leukemia means blood cancer. There is another disease called leukoderma. Leukoderma means white skin. Leukoderma means white skin. Leuk means white, derma means skin. The other name for leukoderma is vitiligo. In vitiligo, a patient develops white patches on his skin, whatever is the color. White, milk white patches. Usually they develop on the face or chest. So from the leuk you make two words: leukemia, blood condition of too much white cell, and leuk, or another word is cancer, blood cancer, and leukoderma, white skin, which is commonly known as vitiligo. It is a skin disease where a patch of skin loses the melanin, that is the pigment produced by melanocyte present in our skin. This in some area they stop producing melanin and skin become white. This is a autoimmune disease. The cause is unknown. Then next word is sign. Sign. CYAN, and O is combining. Cyno is combining form of sign. Osis mean abnormal condition. So abnormal condition of blue. Sign mean blue. Sign mean blue and osis mean abnormal condition. You have seen sometime a baby is born and baby become blue within seconds because the throat and larynx is not clear of the secretions and baby cannot breathe, so oxygen is not going inside. Our skin color is due to oxygen. Oxygen has a very important role. When it is present in the in our body, that has a part in our skin color. So without oxygen, baby turns into blue. The moment they clear the baby and baby start breathing, oxygen reaches to the cells of the baby, baby immediately change the color. But that blueness of the baby is known as cyanosis. Cyanosis. Next word is Melan. MELAN/O. Melan. Melan mean black. Melanocyte, we have cell in our skin which is called melanocyte, and it produces a pigment which is known as melanin. Melanocyte produce melanin. Melanocyte produce melanin, and it is the melanin which gives our skin color. We have same number of melanocyte in our body, all white, black people and brown people. Everybody has same number of melanocyte per square inch of the skin, but in white they produce the least amount of melanin. In black people, the melanocyte produce the maximum amount of melanin, and in brown people they give moderate amount of melanin. So it is the melanin which gives us color. One good thing is melanocyte is the protection against sunlight, or precisely against ultraviolet rays that are present in the sunlight, and that causes skin cancer. Black people have maximum amount of melanin, so there is least chances of skin cancer in black people. But white people are most prone to skin cancer because they have very less amount of melanin. And brown, Mr. Brown, they have moderate amount of melanin, so they are moderately vulnerable to skin cancer. Cyan mean blue, erythral mean red, cyan mean blue, leuc mean white. Next word is polio. Poly. Sorry. Poly mean grey. Poly/O. Vowel. It mean grey. The word is poliomyelitis. Poliomyelitis, this is a disease that affects mostly children. Poly mean grey. Myel means spinal cord. And itis mean infection or inflammation. It has two meaning: infection and inflammation. two meaning. So poliomyelitis mean infection of the gray part of the spinal cord. Infection of the gray part of the spinal cord. Spinal cord is a longitudinal structure and white, but if you take a cut section of it, from inside, it is like this. There is a H-shaped structure inside in the center, and that is gray in color. This one is gray, and all other area spinal cord is white. By the way, all our nervous system consists of these two colors, gray and white. But in the spinal cord, the center is gray and the surrounding is white. So it is this area that is infected in poliomyelitis. These horns which are going to the legs, branches from here are going to legs, and they control the muscular movement of the muscular power of the legs. If they are paralyzed by polio infection, then baby become paralyzed. So poliomyelitis here. Poliomyelitis means infection of the gray part of the spinal cord. Myel means spinal cord. Poly means gray. Itis means infection. Infection of the gray part of the spinal cord. So we talked about red, eryther. We talked about leuc, which is white. We talked about cyan, which is blue. And we talked about myelin, which is black. These are all word roots which give us colors. I think this is enough for this lecture. We will continue this topic, and next time I will discuss this suffix. Thank you very much.